Thank you, Dr. Anuradha, for reminding that Chandra is also, and she's also an important part of the group because she also participates very, actively. So everyone, I was saying that we missed Anuradha and Dr. Kunal in the last session because there are people who are very active and who are very, good at stirring discussion. So both of you were missed in the last class. So humble request to all of you to be present because it's a small group. I keep it small because I want everybody to, actually get in one touch with me. I can go for even 20 participants in the program, but then it will not benefit you. But then the onus lies on you to be always present in the program because the strength of the program is all of you and everybody has to be, present to really participate. Okay, so the topic of today's discussion is resolving patients' complaints. So if I may ask all of you, how important it is to resolve patients' complaint? If you could just, raise your hand and one by one, if you could answer. Dr. Preeta, you want to answer first? Okay, please go ahead.
Yeah. First of all, what we do is here, as soon as we have a patient gets explained.
My question, please understand my question. How important it is to resolve complaint?
It is very important.
I'm not asking for this, that we'll talk about it, but yeah, please.
So that is very important to resolve a patient's complaint or a grievance or whatever as they perceive it. Mm-hmm. Because an aim of a hospital or an organization is that when they walk out happy. That is the goal of the day for everyone. So
absolutely wonderful. So anybody else? Yeah. Thank you. I think that's very important. The goal of every hospital should be that when the patient is going out, they should go back satisfied. I completely agree. So why else do you think resolving complaint is important? Anybody else?
One of the important part would be by resolving a small issue or a small complaint, we may help in the overall well-being of that person and the family and make sure that they are happy. And even smaller issues can, if not resolved at a proper time and in a proper way, can turn into very negative feeling for the patient, and which it itself would not help in the overall recovery or the stay.
Wonderful. So that's a personal kind of loss to the patient because the patient is affected by it. I think Dr. Anuradha wants to say something. Please go ahead.
I would say it is very important. I agree to what Preeta ma'am and Dr. Kunal said. And also we discussed about Kanu's model last time. So I would place resolving complaints into the basic step of it. I mean, if we do not resolve the complaint, so we are not even meeting the basic need of the patient. We move on to experience or delight later on. But then complaint is one thing. If we do not meet it, the patient is not at all satisfied. So that is where I would place it.
And if you promptly attend it, actually it will be a delight for the patient. Because they don't normally expect, but when you are able to really manage it amicably, they are really delighted. Okay, I mean, this hospital is exceptionally different from others who have heard our complaint and who have taken an action on it. What else can happen? Dr. Tanu, do you have any thoughts on it? In case if you don't resolve, what else can happen?
Not resolved, then things can escalate. If it's not resolved, the things can escalate. Plus, if a complaint is not addressed, it is even our staff can take it lightly that, okay, it's fine to do things the way they are going. So unless it is addressed, they won't change their ways. So that's also another reason.
I think this is very important what Dr. Tanu has mentioned, that if we are not in habit of resolving patients' complaints, then the staff also becomes complacent. And they also think it's okay, patients would come and complain and go, and we don't have to do anything. So as a result, the quality of the service is automatically going to get deteriorated with the time to come, and it has huge repercussions. I've used this term 3 times because I have a story to share with you. It's a case that happened with one of my friends. She's a gynecologist. So she has a small nursing home. So there is this patient who was under her care for antenatal, and that lady delivered in her nursing home. And during the delivery, the family had a couple of complaints. Sometimes they say food is not good, or the room services are not up to the mark, AC is not working. Usually they would have these, complaints. But unfortunately, these complaints were not, managed very amicably, not very effectively. Nobody realized the importance of attending to these things, because this is the way we are used to handling situation. And this lady got discharged. She came back for her follow. This is quite cold story I'm sharing with you, but that should give you an idea what is the repercussions, how serious they can be. So she came back for her follow-up, and she had episiotomy. So episiotomy needed to be cleaned and dressed. So this gynecologist, she saw the patient, everything was fine, and she asked her nurse to do the dressing for the patient, clean the episiotomy, and apply betadine and everything. So this journalist, sorry, one second. Yeah. So this journalist, this patient's husband, who was there with the patient, he requested this gynecologist, ma'am, एक बारी आप देख लेते, she's complaining of lot of pain in the stitched area. So it will be nice if you could look at her once. Now, please pardon my word, but this doctor, she was trained in a government setup. And you would agree with me, in a government setup, when we are seeing a lot of patients, at times our way of handling patients becomes little rude and, blunt. In a very rude tone, she said, and she admitted this to me. She said, in a very rude tone, I said, अरे भाई, ये नर्स का काम है, मेरा काम नहीं है ड्रेसिंग करना, वो करेगी. आपने सुना होगा, I'm sure this kind of statements you must have heard in the government sector. I'm not saying in the corporate sector. So the nurse did the dressing, patient went away. Unfortunately, this patient's husband was a small-time journalist. He got so upset with this treatment that he received at the doctor's hand, plus the past experience of being there in her care during delivery. He really got fucked. Can you believe? He wrote letters to water department, electricity department, biomedical waste, pollution control, and I don't know, and building and building department. He wrote complaints to all these departments against her, that this is what is happening in her setup, whatever was happening. Can you believe? In those days, it's almost like, must be around 25, 30 years. Must be, or at least 20 years. Next 6 months, she had people coming from every department: electricity department, water department, building department, pollution control, everything, anything and everything. I mean, and how do you settle the things? In those days, she spent almost like 8 to 10 lakh rupees to settle these things with those people. And the agony she must have gone through cannot be calculated. So what I want to say, patients' complaints, when they are not resolved, can have huge repercussions. And I'm sure you all must be facing this day in, day out. And most of you must be now very vigilant about handling these cases, because we know the repercussions. Sometimes they may not say you anything. They may go and write ill against you on social media. They may go and complain against you, anywhere where you cannot even imagine. And then tomorrow you are just struggling to settle your scores. So that's why I thought we must have a session on resolving complaints. I'm sure all of you, the position you're holding in the system, you must be well versed with the protocol. You may be well versed with the way you could do it. But I think I'm looking at this topic from the point of view that all of you should take this topic as a training topic with your subordinates, with your trainers, because you may be knowing, but unless you're able to systematically transfer this knowledge and skill with your team, because they are the one who are the frontline staff. They are the one who are handling the complaints at the first point, very first touch point. So I think every training program dealing with communication skills must have this as a topic where you talk to them about how do you go about resolving complaints, and then why should we be resolving complaints, and what is the right way of doing it. So today's topic is all about how do you go about, resolving complaints. Now, my question to you is, I know all of you must be resolving and managing it very well, but I'm going to now flip the equation or situation. Anybody who has faced a very serious situation where you had a very, aggressive, arrogant, rude, dominating person coming to you with the complaint, either you manage it very well or you fail to manage. That's all right. A lot of us have challenges and we are handling it. If you would like to share your experience, maybe we'll spend 5 minutes on sharing experience. So each one of you would get 1 minute if you want to share any experience where you could do it successfully or you could not handle it successfully. Both are okay. Both are okay. Because we want to learn from that. So if anybody would like to share the experience that you have handled. Yes, Dr. Amri. Go ahead.
Ma'am, I have been working in government sector since 2015 as I was a labor room in charge in district hospital, and most of the time it used to happen in night ki gynecologist jo hoti thi, I should not tell it here, but still you already know the condition of government hospitals. So we were told like this ki when she used to leave the hospital at 10 o'clock in the night after 4 surgeries, then she used to tell me ki subah 6 baje tak you don't call me. जो भी इमरजेंसी होगी, पेशेंट कितना भी क्रिटिकल होगा, यू हैव टू मैनेज अकॉर्डिंगली. अब अगर रात की 2 बजे कोई प्री एक्लेम्शिया या एक्लेम्शिया की पेशेंट आ जाती है और उसको कन्वर्जन्स हो रहे होते हैं, तो उस कंडीशन में हमें इमरजेंसी सिजेरियन करना होता है. तो ये होता था कि मैं कॉल करती थी मैम को कि मैम अब मुझे कैसे मैनेज करना है, मतलब मेरी तरफ से मैंने सारे इन्वेस्टिगेशंस करवा दिए हैं, पेशेंट मैनेज कर लिया है, नाउ यू हैव टू कम एंड वी हैव टू प्लान फॉर द सिजेरियन. तो मुझे यही बोला जाता था कि पहली बात तो कॉल उठता ही नहीं था. फिर बहुत एक्सट्रीम पे ये होता था कि एक बार ऐसा हुआ कि एक पेशेंट था, पेशेंट्स को भी पता होता है मैम, एक्चुअली दे आर अवेयर ऑफ ऑल दीज थिंग्स, तो वो फिर कहीं कहीं फोन लगवाते हैं रात की 2 बजे, फिर सीएमएचओ के कॉल आते हैं कि आप मैडम को घर से बुलवाइए. तो मैडम जब घर से आती थी तो शी वाज जस्ट लाइक कि वो इतना ज्यादा गुस्सा करती थी कि मतलब तुमने मुझे बुला कैसे लिया. और उस समय ये होता था कि पेशेंट को संभालना हमारे लिए बहुत मुश्किल हो जाता था क्योंकि हमारी तरफ से सब कुछ सही रहता था, बट अगर गायनिकोलॉजिस्ट ही आके सिजेरियन करने को तैयार नहीं है तो हम कैसे कर सकते हैं. फिर उन्होंने धीरे धीरे ये किया कि भाई पेशेंट को तुम रात में कह दिया करो यहाँ पे मैनेज नहीं होगा, तुम्हें आगे जाना पड़ेगा. तो पेशेंट के सवाल ये क्यों मैनेज नहीं होगा, तो वो हमारे बस में तो था नहीं, तो बहुत मुश्किल जाता था. बट मतलब अनफॉर्चुनेटली फॉर्चुनेटली जो भी था, मैंने कभी ऐसा नहीं हुआ मैम कि पेशेंट मुझ पे एरोगेंट हुए हों, because I knew I used to keep myself at the patient side and I used to think, then I used to counsel them accordingly. So इसलिए I used to do manage well.
Very good. Thank you for sharing your experience. That means you managed at your level in spite of the fact that you did not have much support from the superiors, but you knew how to handle and not to get into any kind of argument with them. Thank you, Amreen, for sharing that experience. Anybody else who would like to share their experience where patients came up to you with a complaint or a request? It can be even a request that asking for something, and either you manage it very well or you actually had difficulty managing.
I can share one incident where one of the patient's relatives, the patient's son, had come to us. Unfortunately, we could not save his father, and he was not present at that point of time. He was traveling out of the city. And we used to communicate regularly regarding the conditions to the relatives who were present here. But the son at the time of taking the body of his father and settling things was very angry and agitated towards the ICU staff. And he started abusing them that because you did not take enough care of my father, he is no more today. And despite knowing all the medical conditions and the severity and everything, he was well educated and towards a very religious inclination. Still, he felt that somehow it was the mistake of the medical staff. And that is how he came to me, and he wanted, and after meeting him and listening to him, it was very clearly understood that what he was feeling was grief. And the thing that he was not present during the last moments when his father passed away. And that was coming up as a guilt that he was not present. And he was taking everything out on the staff members. So we could listen to him, we could tell him that what all care was taken and how things were managed. And after, say, more than 45 minutes, he could gradually settle down. He shed some tears, and he felt that, okay, yes, we understand that this was the situation, this was going to happen. And it is my mistake that I shouted on the staff, and I apologize because they were there when I was not there. They were there with my father. So this was the situation that I faced.
Wonderful. I think, Dr. Kunal, you managed not only the situation, but you managed the emotions also. And very, finally, you have deciphered the emotions that the person would go through when you are in grief. I think we'll be talking about it at length when we'll talk about breaking of bad news or disclosure of error. Those will be the last couple of topics. But very right, whenever there's a death in the family, the immediate reaction is that we don't believe that this had happened, or we want to blame people for what has happened, because that's how we want to, feel comfortable that, okay, it's not me who failed, it is people who failed. And that gives kind of cognitive, balance, because we cannot tolerate the dissonance caused by such events. Wonderfully, but thankfully you managed it well, and you talked to the patient's deceased son in a manner that not only he calmed down, but he introspected and he reflected on it and he apologized. I think that's
the only sentence that helped in that conversation the most was that we shared with him that if he was my father, this would be the best care that we could have provided. And at that point of time, he was satisfied that, okay, if you are saying this statement, it really means that, okay, he was given the best possible care.
So good, so good. I'm sure, I think you have to be really very good at words and choose your words carefully, but then they have huge impact when you are able to, simultaneously show it through your body language, your tone of voice, and your sincerity and responsible behavior that I really mean, and I'm not just saying it for the sake of saying.
Right.
That has a huge role to play. I completely agree. So let's quickly do a small role play, because that becomes a good way of learning. So I'll just give you a situation. There's a patient in the ICU, and the family members are requesting you to, allow them to go and see the patient. And we know the protocol is that we don't allow a lot of relatives, and it's only in the morning and evening, twice in a day we allow. And the patient's family is requesting you, and also that they are quite influential and aggressive, and they can, there's a confusion that they can also harm you in some way if you are not able to manage them well. So will anybody be willing to play the role of the doctor or nurse on duty in the ICU, and somebody who is ready to play the role of the family, who are really, requesting that we want to, or they have come up to you complaining that the ICU staff is not allowing us to see, and we want to see our patient. You can't stop us from seeing. It's very important for me to see my father or mother or brother or anybody. Anybody who's willing to play the role of the doctor or the nurse on duty. See, role plays is the best way to put yourself in that position and see sometimes how difficult it is even to be the nurse on duty who's handling such attendance, or the gatekeeper on duty who's handling such attendance, or the resident on duty. You get to experience that situation, and you really understand how difficult it is to choose the right words, right language, right body language and non-verbals. Anybody?
I would volunteer to become the relative.
Okay. So can I request Dr. Arjun to be the doctor on duty?
Yes, ma'am.
See, by the end of the program, I want each one of you to get used to role plays, because this is one of the most important pedagogies that I would recommend you to use in your programs. These are most thought-provoking, ways to let people, come up with what they think. So, Dr. Arjun, you be the resident on duty. Dr. Kunal will be the patient's brother.
And can there be two relatives?
Yes, there can be two relatives. Dr. Anuradha, you will be relative. So Dr. Anuradha and Dr. Kunal will be the patient's brother and sister. Dr. Arjun, you are on duty. These people are coming to you and saying that we requested the nurse and the gatekeeper to allow us to see, and they are not letting us go in. Please remember, it's not that, okay, I'm allowing you to go. That's not really, because if there is a protocol, we have to follow the protocol, but we have to be creative in finding the ways how we can keep the protocol in place and also satisfy them. That's what we are trying to learn. Okay. Now, rest others who will be observing, keep noting down your observation about how Dr. Arjun effectively handles the situation. And keep noting your point in the chat. Don't keep it in your copy, put it in the chat, but don't hit the button enter. And what we are looking for is what Dr. Arjun did effectively, not wrong, because it is easy to identify what people do wrong. We want to learn from this role play what he did, what all he tried in his ways of handling the situation to resolve the conflict, to resolve the situation, to find a solution, creative solution. And how does he strike a conversation with them? All that I want you to observe, but keep writing in the chat box and hit the enter button after the role play is over. So when they are doing role play, we will all go into hiding. We will stop our video so that only 3 of you are visible. Is that okay? So Dr. Kunal and Dr. Anuradha, do you need any more information about the patient? Or Dr. Arjun, do you need any more information about the patient?
No. We can manage.
Yeah, it's a patient in the ICU. ICU means patient is in critical condition. So family wants to see and they want to visit and see, and this is not the time. So how do you really handle that? That's what we want to see. So we are all stopping our videos so that only 3 of you are visible. So I request everybody to stop the video. And Dr. Amreen, can you please stop your video? Go ahead, please.
Yes. Yes. Yeah. Dr. Kunal and Dr. Anuradha. Right. Yeah. Please tell me. Yeah.
डॉक्टर साहब, हमने कल से अपने मरीज को देखा नहीं है और हमें तो कोई आने ही नहीं दे रहा है. गार्ड हमें हमेशा रोक लेता है. हम क्यों नहीं देख सकते अपने पेशेंट को? उसने कल से कुछ खाया भी नहीं है, हमें देखा भी नहीं है. प्लीज हमें मिलने दीजिए.
Ma'am, I can understand your anxiety. I would request you, if you can come to the counseling room, we can have a discussion, and then we can talk further. Yeah.
Doctor, how can you understand our anxiety? You don't even know. She is our younger sister there lying in the critical care, and nobody is allowing us to just see. Even she is very anxious. How will she recover if you don't allow her family members to come to her? And you are asking us to come to the discussion room. We don't want any discussion, doctor. We just want to see the patient. We won't be disturbing anyone else.
Doctor, I very much
along with us, our parents are also there, and our parents and us both want to see our sister. she's the youngest in the family and we want to see her now.
I very much understand, ma'am, your concern. I would like to share first what is the condition of the patient. So I think the resident doctor has already explained, intensivist has explained about the condition of the patient. So you are very much aware of the condition and he is getting stabilized. Okay. So, and more so because to control infections, spread of infections in the intensive care unit, we
Doctor,
would like to.
sorry, doctor, we already know, we are okay, we know the condition. Only we are asking is to just go and sit with her for some time. She is not, she's our younger sister. We have promised her that we'll take care of her, and if we are not there around, she cannot see us. How will she feel that we are here for her?
And doctor, we
Yes, sir.
saw the parents of some other patient going in some other ward and meeting their patient. Why are we not allowed in this particular ward? Do you want us to approach some political leader and who will give you a call and then you will allow us?
No, not like that, ma'am. I'll explain you. Actually, if you go and visit, more visitors are there, it can spread infection and it can cause harm to the patient themselves also. So that is one reason why we would like to restrict the visitors. And definitely in daily 2 times in a day, we'll allow you, and you can see your patient, and you don't have to worry. We have our staff who are very much qualified and experienced, and doctors are overseeing the staff, and we ensure proper care is given to the patient. That is
Doctor,
my
don't tell us about infections, doctor. Doctor, don't tell us about infections. We are a family of doctors. We know what happens inside the ICU. How many times you all are washing your hands before touching my sister? We will not allow this, doctor. We want to go and meet her. We want to go and meet her right now, doctor. If you want, you can call your superior or someone, or else my elder sister told she will make one call, and then the whole department and the whole hospital will be here in front of us.
We lodge a complaint against you, doctor, that you are not letting us meet our sister. We have to meet her right now.
You don't worry about it. We are taking utmost care, and it is my responsibility that utmost care is given and patient is stabilized at the earliest.
Sir, how can you, doctor, take your responsibility? You will leave when your shift gets over. You have written this patient rights and responsibilities in big boards or put over everywhere. Where is the patient right here? Where is the relative right, doctor?
No, I would take my responsibility, because we would be handing over to the next doctor on duty. So we'll ensure what all handover takeover has to be done. It will be done, and please do not get tensed. And I understand your anxiety, so do not worry.
Let us do one thing, doctor. Once you leave for the shift, allow at least my sister to go. Thank you, doctor.
Okay.
Thank you. Can I request everybody to come in? So, Dr. Arjun, if I may ask you, how was it to be there?
It's not easy, but I think by justifying some of the important aspects, we can actually try to mellow them down.
So it was just, all of a sudden I asked you to do it. But if you had prepared for it, probably you would have done it very differently. So what do you think you did effectively?
I think I could give some reasons where infections can spread and it can actually harm the patient if visitors have been allowed inside the ICU, and that's the reason we actually restrict visitors to 2 times in a day, something. So.
Wonderful. What more do you think you, even non-verbally, you did that you think helped in handling the situation effectively?
Non-verbally, I think, okay. I should have, my reactions were not actually in
No. I'm not trying to find fault. No, I'm asking what you think you did effectively. You were doing a lot of good non-verbal, responses, like nodding. You were leaning forward. That shows that you were trying to listen. You were nodding. You were patient. You were listening to them. You were not interrupting them. They were interrupting you. You were not interrupting them. So that's all non-verbal, and that was really very effective. It was really very effective. So is it okay if I ask others to give their thoughts, Dr. Arjun?
Sure.
I'll ask the family, Dr. Anuradha and Dr. Kunal. What do you think Dr. Arjun did effectively?
And I found his tone of the voice quite reassuring. While I was a difficult patient, even Dr. Kunal was, but then his tone of the voice, the way he was explaining things, sometimes when patients become reactive, then doctors also become reactive, and they, answer back the patient in the same tone, and that aggravates the patient. So we were thinking twice before asking him a question because he was very subtle in answering our question. So I found it really effective, the tone of the voice.
And also, even when you made a mention of that political interference, I can get that. He did not get, baffled. Otherwise, community become. What do you think? Will they come and tell?
He would tell Bulalo this.
Go and call anybody. So true. I completely agree. Dr. Kunal, what is your observation? What do you think?
His tone and his communication was quite reassuring. He was trying to convince that he is there and he's taking care of our patient, and that helps. He said that he understands what we are going through, and so that way he was very good in trying to convince.
Yeah. So in the end, when you said, "Okay, please allow my sister to go," did that?
It was like bargaining. That at least.
Dr. Arjun, would you have allowed him, his sister?
This is it.
Sometimes, yes. We don't have to take a rigid stand.
Yes.
Just saying, no, this is not the protocol. I think we are being too rigid, unnecessary.
Very much.
So sometimes you have to see the sensitivity of the situation and maybe align a bit to let them also align with you.
Definitely.
Okay, let me ask all others if they have written their points in the chat box to hit the chat enter button so that we can read everybody's. Yeah, Dr. Tanu says he was staying calm with this soothing voice. I completely agree. What about others? What is others' observation? So I could hear you listening very attentively, Dr. Arjun, right from the beginning. You allowed them to complete. We have a tendency to interrupt. I think you were really keeping, patients not to, interrupt them. And you even said that I very much understand your point of view, your concern. That really shows the family that, okay, there is somebody who's understanding my plight or my situation. Then attendants interrupted, but we did not get upset. Although it was a role play, so I can understand we are more cautious in our this thing. But if we can bring this in our regular communication, a lot of problems can be managed if we allow the patient to complete what they want to say. So you are nodding head. So that also shows that I'm listening, I'm understanding, I'm agreeing to what you're saying. And even when they made a mention of political interference, you did not get upset. And in between, you said, it's my responsibility. I only say when you say it's my responsibility, we need to be a little careful because sometimes this is taken in other way and then you can be in trouble. So I will talk about it, how we have to really, be careful in saying something like this. Patient will be fine. Don't worry, she will be fine. And unfortunately, if the patient dies tomorrow, then they're going to come and catch hold of your neck that you said she will be fine and you didn't allow us to see also. So, I mean, what do we do? Okay, Dr. Amreen has said that managing the situation it was done very well by Dr. Arjun. Yes, I completely agree with you, Amreen, that he was very calm and composed when he was handling.
One experience I would like to share that we were posted in COVID duties. And we used to have counseling session of the patient's relatives regarding what is the condition of the patient who were admitted in our hospital in government setup. And there was a time that a patient's relative came and he requested me a lot to see his mother. And he told me that we don't have our father with us, and he passed away long back, and we have only my mother with us, and she was in ICU for 15 days, and now she's shifted to ward. So since 1.5 months she was in our hospital, and he requested me a lot, so I took him to the ward, and I let him meet his mother. Both of them cried a lot after seeing each other, and he really thanked me a lot. Ke, ma'am, nobody allows us to come here, but still you did. And that auntie, she was also very happy to see her son. And then she got discharged with him.
So that means unless there is a risk to patient or to the family, for example, if she was in active phase of COVID-19, of course, you would not have agreed to it. No? Then probably would have put in more effort in explaining to him that why you are not allowing. No, but then if it is okay, then let's not be rigid about rules. Sometimes
even I asked him also, ma'am, that you don't have fear of getting the infection back to you if your mother is admitted in the hospital. He told me, no, ma'am, I have my proper precautions, but I just want to see my mother once. So I took him with me.
True. So Namrita has also written that he used calm voice and he tried to give proper information. I think that's very important, where he tried to give information in a manner that really helped the family to be more realistic in understanding the situation. So I think, Dr. Chandana, do you have anything to mention? Do you have any thoughts about Dr. Arjun's role play, what he did effectively?
I was just amazed at the role play, actually. They're really so accurate. Yes. I mean, I was listening to them and I was thinking, oh my God, I don't feel like anymore like they're actually playing the role, because this is what happened all the time.
Yeah.
Yeah. And many
Especially
times
that politicians thing, no? That we politician go phone karti ho.
And those subtle threatenings and everything.
And that is where you have to really have a very strong control on your emotions. Because the tendency is in that situation, we become aggressive and we retaliate. The moment you retaliate, things go out of control. So I always say communication is not what the patient says. Communication is where we forget what is the right way of communication. That is where the communication breakdown happens. Patient would come aggressive and they are in pain, they are suffering, they are already in distress. So expecting them to behave and think rationally is not sensible. We got to be ready to deal with that irrationality. So it's more like, knowing that I'm dealing with a crisis situation where people are already disturbed. That's something we have to really learn and practice. Dr. Tanu, you want to say something? Please go ahead.
Our medical superintendent, she used to say that you have to remember that you have to be patient with patient. That is why he's called patient, because you have to be patient with them. So
absolutely, so true, and I think that's very important. I think we had a wonderful learning from Dr. Arjun's role play, and Dr. Kunal and Dr. Anuradha played a wonderful role of the patient's attendant, because that's how the family feels. They're so desperate to meet. And also a point here I want to say, sometimes the patient is in very serious condition. The prognosis is very poor. And there, if we are rigid with the family and not allowing them to see, and unfortunately, if the patient dies in between, before the next meeting hours, I think they're going to curse us for the reason that you didn't allow me to see my patient. And we got to be more compassionate and understanding that probably these are the last few hours when the family can see their patient alive. So there, I think even if we have to go little here and there, it's perfectly all right. And see the larger interest, see the actual, keep the patient and the family's welfare in mind when you are talking about the rules, regulations, or protocols. They are meant to facilitate our life and not to create hurdles for us. I think that has to be the mindset. So let me quickly share the presentation with you that I have kind of prepared for all of you. Any questions about what we have? Anything that you wish to say? Yeah, Dr. Arjun, go ahead.
मैम आई जस्ट वांटेड टू नो कि जैसे 2 बार तो अलाउ होता ही है रिलेटिव्स को कि आप आकर मिल सकते हैं, बट मोस्ट ऑफ द टाइम इट हैपेंस कि वो उस टाइम तो आ ही जाएंगे, उसके अलावा भी दे कम बैक अगेन एंड अगेन बिकॉज मोस्ट ऑफ द रिलेटिव्स कम एंड विजिट द पेशेंट इन द हॉस्पिटल. So how to manage that?
Okay, so let's quickly do a role play. I mean, you be the patient's attendant who's coming frequently, and I be the resident on duty. You are coming frequently, and I need to tell you that you can't be allowed this way. ठीक है. So I think, can I request everybody to have their video off so that we both are visible clearly to all of you? Okay. So I am the resident on duty. Amreen, you are patient's daughter. What would you like to be?
I'm mother.
Mother.
Because I am posted in labor rooms, I have experience of.
You are the mother. Okay. So and I'm sitting there, and you come in. So I'm saying कि अमरीन, आप जो बच्चा बेड नंबर 6 पर है, उसकी मदर है ना? नहीं, पीडियाट्रिक केस नहीं लेना, हमने लेबर रूम का केस लेना.
यस मैम, यस मैम.
सो अमरीन जी, आप जो पेशेंट रजिया है टेबल नंबर 6 पर जो है, उनकी मदर हैं आप?
जी मैम, जी.
मैं एक चीज आपसे कहना चाह रही थी कि आप बार बार आप अंदर आ रहे हैं तो पेशेंट के लिए बहुत अच्छा नहीं है. मेरी रिक्वेस्ट आपसे ये होगी कि जो मिलने के टाइमिंग है, अगर आप उसमें आएंगे तो बहुत अच्छा रहेगा.
मैडम, हम क्या करें, हम सुबह से इतनी बार पूछ चुके हैं हमारी मरीज कैसी है, हमको कोई बता नहीं रहा है, कोई अंदर नहीं जाने दे रहा है, तो इसलिए हमें बार बार आके पूछना पड़ रहा है, क्योंकि आपको भी पता है कि डिलीवरी होती है तो मरीज को कितने ज्यादा दर्द आते हैं. अब उसके दर्द लगातार बढ़ते जा रहे हैं, लेकिन कोई उसको संभाल नहीं रहा है. तो अब कोई नहीं देखेगा तो हमको तो रहना ही पड़ेगा ना उसके पास.
अमीन जी, ऐसा है कि एक तो 2 बारी तो हम सुबह शाम तो बताते ही हैं पेशेंट की कंडीशन के बारे में. दूसरा ये है कि जब भी कोई थोड़ा बहुत भी चेंज आएगा तो आपको डेफिनेटली बताया जाएगा. अंदर नर्सेज हैं जो लगातार पेशेंट पर नजर रखे हुए हैं, उसकी कंडीशन पर, बच्चे की कंडीशन पर नजर रखी हुई है. और कुछ भी अगर चेंज होता है तो हम जरूर फैमिली को इन्फॉर्म करते हैं.
मैम, आप तो बहुत अच्छे हैं, आप तो बता देंगे, लेकिन यहाँ की जो नर्सें हैं वो बिल्कुल अच्छे से बात नहीं करती हैं. हम पूछ के थक जाते हैं, बताती नहीं है. अब आपके बाद जो डॉक्टर आएंगी, हमें क्या पता वो हमें बताएंगी या नहीं बताएंगी, क्योंकि यहाँ के सारे डॉक्टरों को हम देख चुके हैं, सब आपके जैसे नहीं है. तो मैडम,
देखो,
हमें
ऐसा
मानना ही पड़ेगा.
मैं समझ सकती हूँ, क्योंकि देखो लेबर रूम एक बहुत ही इंटेंस वर्किंग प्लेस होता है जहाँ पर काफी मतलब हर वक्त डिलीवरीज हो रही है, मदर जो है वो पेन में है. तो कई बार स्टाफ और डॉक्टर सब लोग जो है बहुत ओवरवर्क्ड होते हैं. तो हो सकता है उनका व्यवहार उतना अच्छा ना हो आपके प्रति, पर इसका मतलब ये नहीं है कि पेशेंट की केयर में हम कोई कमी कर रहे हैं. पेशेंट की पूरी देखभाल होती है. कई बार परिवार के साथ हम बहुत अच्छे से नहीं बात कर पाते, पर मेन ये है कि पेशेंट को हम अच्छे से देख रहे हैं. तो मेरी रिक्वेस्ट आपसे ये होगी कि आप बार बार अंदर ना जाए, क्योंकि बाकी दूसरे जो पेशेंट हैं वो भी अनकंफर्टेबल फील करते हैं. आपने देखा होगा अंदर और भी लेडीज हैं, तो कोई पेन में है, किसी ने कपड़े कैसे पहने हुए हैं, किसी के कपड़े ऊपर हैं नीचे हैं, उनके लिए बड़ा डिस्ट्रेसिंग हो जाता है अगर कोई भी और अटेंडेंट बार बार अगर अंदर विजिट करते हैं.
मैम, तो फिर आप जवाबदारी लेंगे हमारी मरीज की कि उसकी डिलीवरी अच्छे से हो जाएगी और नॉर्मल होगी और ऑपरेशन की जरूरत नहीं पड़ेगी? आप लेंगी सारी जवाबदारी?
देखिए अमरीन, आप जो ये बात कह रही हैं जिम्मेदारी लेने की, मैं ये प्रॉमिस कर सकती हूँ कि पेशेंट की केयर में कोई कमी नहीं होगी. जो भी ट्रीटमेंट उसकी होनी चाहिए वो ट्रीटमेंट उसको पूरी मिलेगी. और अभी तक अगर उसकी प्रेगनेंसी ठीक रही है, उसकी हेल्थ अगर अच्छी रही है, जो कि मैं उसके रिकॉर्ड से देख पा रही हूँ कि उसने पूरी प्रेगनेंसी में वो रेगुलर आती रही है और हमारे यहाँ चेक होता रहा है, तो सब कुछ ठीक रहा है. तो मैं उम्मीद करती हूँ कि उसकी डिलीवरी भी अच्छे से होनी चाहिए. और अभी भी उसकी कंडीशन ठीक है, और जो पेन है वो बहुत ठीक तरह से प्रोग्रेस हो रही है, जो लेबर पेन्स हैं. तो मुझे पूरी उम्मीद है कि सब ठीक होना चाहिए. लेकिन जिम्मेदारी ये है कि मैं उसकी केयर में कोई कमी नहीं करूंगी, और ये मेरी जिम्मेदारी, इसकी मैं जिम्मेदारी लूँ. ठीक है?
ठीक है मैम.
ठीक है. तो मैं रिक्वेस्ट करूंगी कि आप बाहर वेट करें. अगर मुझे जरूरत होगी तो मैं खुद आपको अंदर बुला लूंगी.
ठीक है मैम.
थैंक यू. So can I request everybody to come? So Abreen was a good attendant. She could have been more aggressive, but she did put me in tight spot by asking. जिम्मेदारी लेते हैं, ये बहुत ऑफन ये आएगा आपको. ये अभी हम आगे भी कुछ टॉपिक्स पे रोल प्ले करेंगे, वहां पर भी फैमिली आपसे बार बार कहेगी कि गिव मी गारंटी दीजिए कि पेशेंट ठीक हो जाएगा, गारंटी दीजिए सर्जरी भी ठीक हो जाएगी. हाउ डू यू हैंडल सच क्वेश्चंस? We are going to talk about it, but we'll do that later. So right now we are focusing on resolving complaints. But अमरीन, जो अभी मेरी और आपकी डिस्कशन है, देखो इसमें कितने सारे पॉइंट्स वैलिड हैं. Leaving a patient's attendant with the patient in the labor room is must. I am one of the NCOA's assessor for government setup, and we encourage that please allow an attendant with the patient. One patient feels comfortable that there is somebody. Plus, you have an eye right there observing the patient, and the attendant will come and tell you immediately if there's any change. Rather, you will be saving the patient and the baby if you have an attendant around. I think only fear we have in having the attendant around is that we feel we are being monitored. But if I am right, let anybody monitor me. Why the hell am I scared to be monitored? Problem is, we don't follow the protocol, so we are afraid that attendant might go and talk ill about us. But if my behavior with the patient and the attendant is good, we have nothing to talk ill about me. So if you look at the conversation you had with me, yes, there should be an attendant. Yes, they should be allowed. Maintain their privacy, have curtains in a manner that all other patients feel safe, secure, and their privacy is looked after. But why not have an attendant with the patient?
Ma'am, it also allowing an attendant to be with the patient, especially in obstetric labor room, it also prevents us from ending up into the unnecessarily complaints later on. Because
Yes.
most of the time it happens that birth asphyxia हो गया या baby बहुत critical condition में चला गया, तो attendants come back and they say कि आपने तो हमको क्या पता अंदर क्या हो रहा था, आपने हमारे patient के साथ क्या किया.
Exactly. I think you're very right. Very right. So let me quickly, share the screen and the protocol with you that I have kind of, prepared to discuss with you. How do you really go about handling, patients' complaint, resolving their complaint? So I think the first question that I want to, the first thought I want to share with you, that 75% of our patients' footfall is due to the word of mouth that our satisfied patients spread. So we really need to understand the importance of sending our patients satisfied. And effective handling of patient's complaint is one of the greatest source of patient satisfaction. There will be complaints, there will be requests. It cannot be that there will not be any request or any complaint, but how you handle that situation will decide, are they satisfied, are they delighted, or they are unhappy with you. And poor communication is the lead cause of violence in healthcare. And effective handling of complaint in the beginning right itself can prevent most of these violent situations. Because there will be initial interaction that will show you that they are unhappy and they have some grievances. If you address them right then and there, you can manage to prevent the violent situation. Later. By the way, why do patients complain? And what do the complaining patients want? What do you think they want?
Attention.
Yes, attention. Very true.
They want to be heard, ma'am.
Yes, very true. They want to be heard. I think that's one of the primary things they're looking for. Please, somebody listen to me. What more?
Appropriate care.
Yes, appropriate care. In case if they're feeling that this care can end up into some lapses in the patient's, care and recovery, they are definitely wanting appropriate care to make sure that the patient is safe. So patients, as you said very correctly, that they want to be heard. They want somebody to listen to them. They want to be taken seriously. A lot of time they'll come up to us and we will say, okay, and we will not take any action. So they immediately get a feeling that my complaint has not been taken seriously. They want to be treated with respect. Because a lot of time we are disrespectful by not listening to them attentively or not taking their words seriously or not taking any action to what they say. And most of them would want immediate action, especially if it is related with the patient's care and recovery and safety, then they want an immediate action to be taken. A lot of them also, and they would ask you for compensation and someone to be reprimanded or punished in case if there has been a major, lapse in the patient's care. And then also make sure that the problem never again happens again, or the same situation never happens. This assurance they always look for. So, and tell me, where are they wrong? Tell me if there is anything that is wrong. We may not like the word compensation, but if I have failed to deliver the promised service, how are they wrong to not get compensated? Although we don't like the idea. And I know this. If you buy a product and if you don't like it and it's not giving you the desired result or service, don't you call and tell them that please replace it? Please give me a credit voucher, or please take it back. I'm not going to take it. We have always taken our patient for granted that whatever we give, you have to accept it, and whatever we charge, that's with us, and you cannot ask for compensation. But I think slowly things are going to really, really change. So when patients complain, most of us don't like. But this slide will help you understand why should you encourage complaints. Because if you are getting complaints, of course, that's a feedback. That means there are a lot of areas that you need to improve on. But trust me, complaints are a second chance to improve your service. Because in case if you have done something, patient does not come back to you complaining, but they will not come back again. So it's a second chance to correct your mistake and then get them back. Because most of the patients, if they are given appropriate or suitable, correction, they are likely to come back. Resolving complaint is equal to loyalty. So if you are able to resolve complaints, you are able to earn their loyalty. Ignoring complaints means it's a damage to your reputation. They can go to social media, they can go and complain, they can sue against you, they can put you in trouble, they can like the story that I shared with you, that's a real life incident. They can go and damage you in number of ways. Then you get valuable information about the gaps in your services if you listen to their complaints. And then based on that, if you remember the last session of design thinking, you are able to get an idea where all I need to plug in the gaps. You know what CAPA I need to do, what corrective action and preventive action I need to take to prevent these complaints from happening again. Of course, it also increases confidence at a personal level in the patient, in the person is complaining, and in us also, because now we know we are on the way to improving and way to implementing quality. Dissatisfied customers are most likely to return if their concerns are attended suitably. So if you are able to address their concern, they're going to go back happy. So the customer responders, it could be the front desk staff, it could be the nurse, it could be the resident on duty, it could even be the floor manager. So you will see some of them, you will find them very passive responder. So you go to them at any point of time with any complaint, you will see that they are not in mood to listen or take any action. So they will always have a reason to tell you, I can't do anything. Then there are people who actually become very aggressive, and you will see them, you can see in their behavior that instead of listening to their complaint, they'll actually start, offending the patient or the person who has come back complaining that, what you're talking is bullshit and I'm not going to listen to that. But the right approach is where you actually listen to their problem and you are into the problem solving approach. And that is what is the agenda of today's session. How do you go about handling patients' complaint? So I think very important is to communicate the process. Whenever somebody comes with a complaint, it's very important to first of all identify yourself and your role. So when you are sitting to somebody, tell that I'm a floor manager and I look after the floor issues. I'm happy to help you. So you are telling your role and who you are and how you are going to help them. Anticipate their questions using your experience. If you are in habit of handling such situation, you would know what kind of request or complaint they're likely to put, or the question they're going to put, and what do they want to know, or what do they expect from you. If you are ready with this, then you would know how I'm going to handle it. Then explain them the process and procedure in plain terms. So whatever they are saying or asking, if you can tell them what is the procedure that you will be following. So I'll be listening to you. I'll try my level best to help you. But in case if I'm not able to do it, don't worry. I'll put it to my seniors and I will seek their opinion and get back to you. So that means you, in a nutshell, you have given them what procedure you are going to follow in handling the complaint. Acknowledge. I think that's a very important step that you need to remember. Acknowledge their emotional pain, feelings of helplessness and fear. Please remember, patients and their family are day in, day out facing this, and we need to be more compassionate and understanding by expressing empathy. Empathize. Put yourself in their position. If you were the patient or if you were the attendant, what would you feel? How would you want? What would you want? If this is what you are going to follow, then definitely they are going to, be happy with the way you have handled it. So generally try to address their concern and meet their expectation as far as possible without compromising the protocol. So how do you go about doing it? I think the first thing is we need to understand why they are complaining. So try to ask and understand their concern. Check with them what is bothering them, what is their concern. And when they are talking about their concern, as we said, one thing that they want is somebody to listen to them. So if I'm standing on a counter and the patient is speaking and I'm doing something and I'm just listening, that shows that I'm not listening to you. On the other hand, if I say, okay, I think you want to say something, let's sit and talk. Like Dr. Arjun said to Dr. Anuradha and Dr. Kunal, let's sit in the counseling room and sit. So for a minute, Anuradha and Kunal were taken aback. We have come complaining and he wants to sit and talk to us. What is here to talk? But then, if you give them that safe place, you will be able to, first of all, comfort them. And then also, if you have something to say, even you will be able to respond, comfortably in a safe and a separate place. So give them a safe place to express, make them sit and talk, listen to them attentively. When they are sharing their concern, it's very important to demonstrate that I am listening. So if you saw Dr. Arjun, he was leaning forward, he was nodding, he was making eye contact. So when you are able to demonstrate this, look interested, involve yourself, stay focused, understand, evaluate the message, neutralize your feeling. So this is what you are practicing when you are actually, demonstrating that you are listening attentively. Half the suffering diffuses with someone listening attentively. Patients are happy if somebody is at least ready to listen to what they are saying. So when they are listening, listen to the person's frustration. Don't focus on the behavior, but look at the feelings that they are experiencing. Like the example Dr. Kunal shared about that attendant who came fighting with the ICU staff. So if you look at the behavior, you would be unhappy about the behavior. We looked after your patient, you are fighting with us. How stupid you are. But rather than focusing on the behavior, if you could look at the inner process that the person was going through, we could make out that he's guilty, he's sad, he's upset, he's grieving. So you would rather listen to the person's frustration, empathize with their plight, understand how they perceive the situation and what they want that they are not getting. So if you are listening attentively, they are able to see that you are listening to them, with attention. So when they are sharing their concerns, stay calm and composed. That's very important. Do not interrupt. Allow them to complete what they are saying. Don't try to correct them. Like Amreen said, nobody is looking after the patient. The nurses are not caring. I did not try to correct her. What I said, see, labor room is a very intense place. We are all very busy. We are dealing with a lot of patients. So we may not be nice to you, but when it comes to handling the patient, we are very careful. So I made it very clear without correcting. How can you say this? How do you know this? Do you know what we are doing? Do you know the pressure we are facing? I did not try correcting that. Don't be in hurry to justify yourself. The moment you try to justify yourself, you feel on defense. So you have to be careful that you are not on defense. Mind your facial expressions. If they're showing anger, aggression, passive aggression, they would know that we are not happy to listen to what they're saying. And your body language when you're listening to them. Recognize and acknowledge their feelings. I think this is very important. Even if you say, I can see you're very upset. I can see you seem to be very concerned. I can see you are really, really, anxious about the patient's condition. When you label these emotions, when you name these emotions, it gives a word to the patient or the patient's family. And they also get a feeling that you are able to recognize and acknowledge their feeling. And this is one of the best ways to calm anybody in that situation. Now, after understanding their concern, it's very important to reassure prompt services. Let me see what I can do. I understand what you're talking about. Let me understand the situation and get back to you. Not that we are saying, okay, I will do, but you are reassuring them of prompt service or prompt action. Make all efforts to reduce their suffering and minimize the damage. It could be they have been waiting for quite long, or they were, waiting for an investigation, and suddenly the machine has gone, dysfunctional. Now they've come to you and complaining that we have come for almost like 200 kilometers from here. We left 6 o'clock in the morning, and we were here by 8 o'clock. My turn was due at 11 o'clock, and now they're saying that the machine is, it's not functioning. So we are postponed. So now you know that they have actually suffered. They got up in the morning, they traveled 200 kilometers. They have come for this test. They were given this appointment. So if you can look at their point of view, their all complaints are very genuine. So how can you minimize their damage or minimize their suffering? That is the approach that we need to, keep in mind. And in that, always please keep the patient's welfare in sight. I think if you have that focus, you will be creative in finding your solution for the patient's problem. Apology. How many of you agree with apology? I want to know this because this is an interesting thing. How many of you think, yes, apology is important, or should we apologize or not?
While dealing with behavioral complaints, for example, rude behavior of a staff or a doctor or anyone else, I think apology on behalf of the staff or the team members would be a good idea. And what I think that if it is a very clinical topic or something related to treatment where we are not very sure whether any mistake or error has happened or not, it is not a very good idea to apologize unless we find the correct thing or the detail.
I agree with you, Dr. Kunal. Let me ask what others say. I agree with you. What do others say? Is it easy to apologize?
Ma'am, regarding the same thing, regarding the behavioral part and regarding the communication gap or miscommunication or probably some kind of delay or anything, it's really helps to calm down the patient attendance actually. So sorry really works, and obviously that has to be genuine at the same time.
True, I completely agree. Dr. Tanu, you wanted to say something.
Yeah, I agree with Dr. Kunal that where there is a behavioral problem, one should certainly apologize. In clinical situations, it can be either way. It can be taken that you have made a mistake, or but also on a couple of occasions, I have seen that an apology has worked very well. But I think that will depend on the level of understanding between the health professional and the patient relatives. Yeah. So
I agree.
I mean, in one case, I remember the baby died, and I said, "I'm sorry, we couldn't save the child." And also they said, "No, and we know you worked very hard." But it can also go the other way, that they might feel that you have made a mistake and that you're trying to, that's you're on the back foot. People might feel that also. So that can be dicey.
Exactly. But a lot of time, if even an error has happened by you, and if you apologize, most of the anguish goes down. And there are studies to support this. I'll be sharing that when we will talk disclosure of medical error in the last session. I'll be sharing.
I have seen a couple of cases, like in my own hospital. I mean, that was several years ago. There was a sudden IUD, and finally, when the baby was delivered, it was a 3 kg male baby. In Haryana, male baby is this thing. Yeah. And I remember doctor just quietly, very, very quietly, she said, "I'm so sorry this thing happened." And they accepted it. But like I said, depends.
So that means, Dr. Tanu, very important thing is what has gone before that. Yes. I always say, communicate, 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 and communicate for the rainy day. If I have been able to establish good rapport with the patient, if I've been able to demonstrate that I'm a responsible doctor, if I'm able to demonstrate that I look after you and I care for you and I'm concerned about you, even at the end, if the outcome is not as per the expectation, they will still accept it. I remember I was taking a session for AIMS Rishikesh. So Dr. K.P. Malik was there, who was head of the department of ophthalmology, Safdarjung Hospital. So right now, I think he's there in Rishikesh, AIMS. So he shared his experience that he said, after operating, there have been cases where we not only lost the sight, but we also lost the eye. Patient went into endophthalmitis and then we had to enucleate. Can you believe even then patients came thanking him and saying, you did everything to help me. It was my bad luck. But yes, very rightly said, sorry has lot of role in lot of situations. But again, it has to be done carefully. So let me explain you apology in a little more detailed manner so that we have clarity on what do we mean by saying sorry. So apologize for the inconvenience, but you got to stay professional. Especially, please remember, apology has two meanings. One is expression of compassion. I'm so sorry that this has happened. That is expression of compassion. Expression of responsibility when you say, I'm sorry for my staff misbehaved with you. I'm truly sorry. The first is always appropriate. The second is appropriate only when it is true. If it is not true, then we got to not say this. Then the first statement would be fine. And how apologies fail? When you say, if what you're saying is true, then I think if you are using ifs and buts, you've lost the game. There was a mistake, but then you can't do much about it. Again, that apology is adding insult to injury. I'm sorry, we cannot attend to your individual request. Again, you are saying, I'm sorry, but I'm not. And then sometimes these things happen and they are not in our control. Again, that's something that you are not genuinely apologizing. And as very rightly said by one of you, it has to be a genuine apology. If it is fake, it is seen. It is well recognized by your listener. Now, after you do the apology, then explore alternatives. The idea is focus on the solution. Don't be adamant on what we do is the only way and the right way. No. Please be open to the idea of knowing what the patient wants. Maybe what they're asking is very simple that can be done. Why do you need to pick multiple battles unnecessary? So check what the patient wants. Sincerely try to resolve the issue and address their concern if it is within your scope. Focus on the solution than the patient's behavior. Sometimes we look at the behavior and we get upset with the behavior, and even something that you can do and you would do otherwise, you would become adamant, no, it will not be done for you because you are not behaving in the right manner. So that's not the right approach. And then avoid being defensive. A lot of time, just being defensive can also complicate the situation. So things that you need to remember when you are exploring alternative and trying to resolve a complaint, first of all, address their concerns genuinely. If inside you say, I don't care, it's visible on your face and your body language and in your communication. That's not done. Address their concern, not by tit for tat. A lot of time when we see misbehavior, we try to kind of, give them tit for tat. Again, not a good idea to resolve the complaint. Or sometimes even we don't give them, the basic things that we would otherwise offer to other patients. Talk to them and help them see your perspective. Probably that will also give them an idea. Like, for example, when Amreen said that nurses are not looking after my patient, or you people don't talk to us nicely. So rather than replying to her statement, I decided to help her see my perspective. See, we are just 4 of us and there are 10 patients, and we are seeing your patients, turn by turn, and your patients are under our observation. Don't think that we are not attending them. So rather than replying to her complaint, I tried to help her see my perspective. Avoid arguing, instead assert. And we are going to have a complete session on assertion. That's very important. I think each one of us must learn how to assert, and we'll be doing this in the next session. So avoid arguing, because arguing on anything would take you to downhill. So some of the communication tips that will help you to handle such situation is take a deep breath before you respond. And if you even stop for a couple of seconds before you say anything, trust me, your internal communication will change. Don't react, respond. So take a deep breath means just a couple of seconds, 1, 2, 3 seconds. You will see your content would be very different. Don't answer for the sake of answering. A lot of time we just want to respond. Give yourself time, you will be able to handle it better. Then Speak in a slow, confident, and clear voice. You have to check your volume, you have to check your tone of voice, you have to check your quality of, if you remember what we talked in the second session about the nitty-gritties of communication. Any communication can be won if you know how to, look after your tone of voice, selection of words, and the speed of talking, and your facial expression. Mind your words, very, very important. I remember in one of the government hospitals, a young lad, who was going to deliver his sister's wedding cards, unfortunately met with a road accident. And he died on the spot. His body was brought to the hospital, and it needed to be, to undergo postmortem, because that's the protocol. And unfortunately, in that hospital, we didn't have the facility of, postmortem. We didn't have the team who would be doing it. So the team had to be invited from the other hospital. The family was informed that the postmortem will be done tomorrow. So you will have to wait. They requested that please allow us to take the body or do the postmortem as early as possible so that we can go home and cremate. And then, naturally, they were in that mood of celebration, and suddenly something like this happened. So with the same expectation, they went to the medical superintendent, requesting him, sir, either take the body to the hospital wherever you have the facility for the postmortem, or call the team today itself and get it done, like whatever is the possible way. And you know what the medical superintendent said? I'll speak in Hindi. I think most of you can understand. Otherwise, I'll translate in English, because I remember the words exactly. He said, "Dekh lo, mitti hai. Chahe aaj karwa lo, chahe kal karwa lo." Did everybody understand? Anybody who wants me to translate in English?
It's dust now, so whether you get it done today or tomorrow doesn't really matter. Exactly. Very insensitive.
And person sitting at the topmost position on the hospital, क्या हुआ होगा इसके बाद में? You can well imagine. So it's not that people at the front desk do not know how to handle. People even at the topmost position sometimes do not know how to handle things sensitively. And this is a real life case I'm sharing with you in one of the government hospitals of Delhi. So you have to be really very careful in choosing your words. Mind your tone of voice. Anywhere, if you're authoritative, rude, aggressive, they can sense it. Facial expressions, you can see in this, if they're aggressive, they are showing passive aggression, they can sense it. Body language, if you're defensive, aggressive, again, they're able to make out how you are responding to them on those lines. I think self-awareness plays a very big role. A lot of us have anger issues. A lot of us become anxious the moment we are handling people in public place. A lot of us are not comfortable handling aggressive people. We really need to know our, inner milieu and see what we are feeling. Don't ignore your feelings. Anywhere, if you feel you're not able to handle it, it's very important to know what is my hot button. Where does my communication break? Where do I become aggressive? Where do I become anxious? So in case if you are really very upset and you're not able to handle it, please let someone else handle it, rather than, getting into an argument and then becoming aggressive and then finally having a violent reaction from the patient party. And please remember stop loss button. Any idea about this? What is this stop loss button? So stop loss button is, anybody who has heard of it? No. Okay. So this is one of the concept I've taken from Dale Carnegie. So he has written that book on how to stop worrying and start living. So in that, he talked about a case where he had, given some money to his friend for investment. And that friend kind of lost a lot of money. So there they evolved this concept of stop loss button. That means normally when you are giving instructions or giving the rights to invest to somebody, to the third party, you give them a stop loss button, that when the value of this particular, product comes down to this, please sell this. Investment, I'm talking about the investment in the trading that we are talking about. So similarly, in your interaction with people, have stop loss button. The moment you see aggressive reaction coming from the person, that's a stop loss button. The moment you see yourself shivering, that's a stop loss button. The moment you think your voice is going, above a level, stop loss button. The moment you feel that you are not able to think, or you have a thought block, it's a stop loss button. So have very clearly the knowledge of your stop loss button and hand it over to somebody, escalate to others. Simultaneously, you need to, I'll be talking about it. And then you need to sit and reflect, that I'll be speaking after this slide. So while you are exploring the alternatives, please explore alternatives with an open mind. Very important. Never be rigid. Understand what does the patient want. Maybe it's something that you can comfortably do. Keep the larger interest in mind. Like, for example, if you know that if I can do this and I can save myself from the major problem, don't be, too rigid on the rules and regulations and protocols. You really need to have that cognitive flexibility where what is okay and what is not okay. Now, I remember in one of the hospital, he looked more like a politician. So he came to the medical superintendent's office, and he was about to get into the office without taking any permission. So normally we have gatekeepers and security staff outside the office. So he stopped this man. He said, "Sir, kahan ja rahe hain? Please wait. You can't go inside like this. Bataiye kya kaam hai, kisse milna hai?" That person was probably politically very well placed. He had gun in his pocket. He took out gun and he just put on the person's forehead and said, "Tu janta nahi mere ko, main kaun hu?" Meanwhile, the MS inside got an idea that there's some kind of noise outside. He came out and he saw this man literally holding his gun against us. He just put a hand in that person's neck, around his neck. He said, "Aa jao, ye naya ladka hai, ye aapko nahi janta." Now, for some of you, it might appear a very unrealistic kind of a reaction, but you got to see how you need to handle this situation. And after that, do you think he could not have gone and complained against this man that he came with the weapon in my office? And this is what he did to my staff? But then you have to pick your battles, because every day you are managing hundreds of complaints and issues. So very smartly pick your battle. Keep the larger interest in mind. That case that I talked about, where the gynecologist spent around 8 to 10 lakh rupees. I think she paid a huge amount of penalty and the agony that she underwent for a small thing. Had she been sensitive to that? So keep the larger interest in mind. Be mindful of the consequences. Sometimes trivial issues can make a big, issue out of it. Assert when the expectation is not doable for you. I'm not saying agree to every request. If something that's not possible, you got to assert. We'll talk about assertion at length in the next session. And in case, if it is not in your authority, assure the patient of escalating to the higher ups for appropriate action. Never end the, discussion or interaction with no outcome. Even if you say, "Sir, I completely understand your point of view, probably that is not in my authority. Can I speak to my higher ups and get back to you? I understand your concern. Can I speak to my higher ups and get back to you?" And you part. Very important, document. Never let a complaint go undocumented. We normally don't document. But if you document, then you have an evidence that this was the complaint and this is what was done. And tomorrow, maybe in the court of law or in person, clarification, this will really, really be a great handy thing for you. So name, contact, background situation, how the patient defined the problem, how you responded in the options you described, what you promised or agreed to do, any suggestions regarding the solution, and how you can be reached for question or report on results mentioned in the complaint while you document. This will be really helpful for future reference. and also, of course, in court of law. Very important step that we need to every time do after we have had a, managing any complaint or issue. Sit back with yourself and check in, reflect. It's also a good idea to discuss with your colleagues. They'll give you a lot of good ideas to handle such situation or prevent such situation. Reflection actually helps us improve. Make it a habit to sit and reflect on how you handled, how could you handle it differently. That will automatically prime your mind with the new ideas, how you can handle it. So to summarize quickly, attend promptly, communicate the process, acknowledge and listen to the patient's complaints calmly, try to understand the root cause of problem, avoid being defensive and respond with empathy. Make the patient feel that their concerns are being taken seriously. I think this is what they're looking for. Apologize and take a quick action to resolve their problem. Communicate clearly what you can do about their solution. Document, debrief. A very important point here, when you are having an interaction, please remember to identify aggressive patients, because that requires advanced level of managing a situation. So in the next session, we'll be talking about how do you handle aggressive patient party and how can you manage to prevent violence in your place. But very important, like we have learned medical triage, we must learn social triage, where you can identify people who can create ruckus in your place. They may not have any social position, but they may have a lot of nuisance value. So it's very important to be vigilant and identify aggressive patient party. Thank you. So, any questions about what we have discussed?
Ma'am, I was just thinking, most of the complaints are repetitive, actually. So I think it helps making discussing each complaint and training the staff on how to handle each of the situation on a regular basis. So this can be part of the induction training when an ICU nurse joins or an ICU doctor intensivist join. I think this can be a part of their induction also.
Definitely. I think CAPA is the approach. You resolve the situation and then you learn, okay, now this has to go in the training. This has to go into sensitization. This has to go into the induction program. And you know how you're going to, prevent and reduce these complaints. I think taking patients' feedback and complaints seriously is the best way to improve your services. Best way.
True.
If you can keep an eye on it as an administrator, you can find where your loopholes are and what you need to plug in. Thank you for your comment, Dr. Arjun. Any other feedback or comment or question before we move on to the next?
I would like to share that maybe we can empower people to take decisions at the floor level up to a certain extent, and that can make the patient feel more comfortable that, okay, the person whom I'm talking to has some power to do, rather than asking for trivial things. For example, maybe the patient is not comfortable with the bed. They can change the bed. They can change the room. Chai thandi ho gayi, to get an extra cup of tea. These small things, if the people on the floor are actually empowered, then many things would be solved and not escalated.
Completely agree. I think that's another good idea to reduce the number of complaints and grievances, and completely agree. But that's again management perspective.
And about written feedback, generally most of the organizations take written feedback at the time of discharge. What we feel is that maybe out of 100 bad experiences, one would write what has actually happened. So it is, if we just go by the numbers and we feel that we are doing very good, it is not actually the case. And when people or patients are actually not very comfortable giving bad reviews about doctors and nurses, because somehow they feel that इनके बारे में बुरा लिखेंगे तो हमारी treatment में there would be some problem. So very easily they would write about cleanliness not very good, or food not being good, or charges, or everything. So even a small amount of poor reviews on this part is actually exponentially quite high.
Yes. And also, it's also a good idea to take anonymous feedback rather than asking the patient's name or bed number and that things. It's good to ask for anonymous feedback.
And many times we solve a lot of problems, so we don't give feedback to the patient that we acted on your complaint. So actually, they never get to know that someone has taken some action.
Very true. I completely agree. So any other thought or question or comment?
I think there should be a complaint cell or a feedback cell kind of a place in every hospital, because most of the time it happens one person is allotted a lot of responsibilities. Suppose in government sector, we have especially scarcity of human resource. So the staff who is posted over there, we just make them the in charge of all the complaints. So there should be a separate body who can look after all these things, and they can communicate with the patients as their feedback.
Absolutely. Absolutely. So if there are no more questions about it, I want to share the feedback form for this particular session, and then we go ahead with the presentation. So who all are presenting today? Amreen, aap karoge? And who's the second one? Who's the second one? I'm really surprised that people have not given their, name for session 6 and 7. Everybody wants 8, 9, and 10. So I'm going to just prepone it, Who has written?
My session is on the 7 one.
That's what Chandana, you have written, but nobody else has written session 7. Oh, okay. Imagine. So if that's the thing, then who will present? We need 2 presentations. And remember, we are on session 6. This is session 6. We are just left with 4 more sessions. So how many presentations do you think we'll be able to make? So from today's session, please have 2 presentations in every session. And so that we cover by the end of program. So I've shared the Google form with you, link for the feedback form for the session. And then we go ahead with Dr. Amreen's presentation.
I have one submission here. While I was listening to Dr. Arjun's comment about empowering the staff, I just got an idea, I got a thought that we should somehow empower the patients also, so that, the complaints and the violent behavior at their end is also lesser, like, having some videos on how what they should expect when their patient is in the ICU. They would understand, and they should be playing always near the ICU waiting area, so that they know what kind of behavior is expected out of them. And also, as a patient, they should not expect to enter the ICU. I'm just taking an example of that. So that can also be a good idea to, not have violent behavior from the patients or many complaints. I just thought of that part, if we can think on that line.
Very true, Dr. Anuradha. Only thing is, I think the concept of patient advocacy and patient experience officers, this is hugely prevalent in Western world, but I think it's going to take good 10, 20 years for India to get open to the idea, where we have people who are ready to work as patient advocate, because we consider them as our enemies or somebody who are going to disrupt our functioning. Even the concept of patient experience officer. Cleveland Clinic, Ohio got back to its foot. Otherwise, it was actually on the verge of closing, if you will read its history, just because it worked on, enhancing patient experience. And they have a team of people who are working as patient experience officers. So when I came to attend their annual summit for the first time in 2019, I came across 1,500 people. A lot of them were either patient experience officers or they were patient advocates. But we are still to get that kind of mindset where we are open to the idea of having such people in the system. So they are like our eyes and ears, provided we take them seriously. But the thing is, are we ready to listen? That's the thing. But I completely understand what you're saying and I agree with it. Yeah. So if I may quickly have the feedback from all of you before we move to the So I've received 4 responses, waiting for 3 more people to respond. So Dr. Amreen, are you ready?
Yes, ma'am.
And I think you will have to share your screen, no?
Yes, ma'am.
So let me give you the... Yes. I think one more person is still to respond. So if you could finish, yeah, all of you have responded. Thank you. So Amreen, can we start with the presentation?
Yes.
Your
ma'am.
discussion, yeah.
Is it screen visible, ma'am, now?
Yes, we can see it.
Okay. So the topic allotted to me is how to use experience sharing as a way to enhance. And I feel it's just like adding drops into an ocean, because our training program is organized in such a way that in every session we just share our experiences with each other and we learn from them.
Amreen, you could use slideshow, then we will be able to see the slide in a, yeah. That's good. Thank you.
So first we'll see what experience actually mean, then importance of experience in memory, role of experience in healthcare communication, advantages and disadvantages, do's and don'ts, and where all it can be used. So experience, जिसे हम हिंदी में अनुभव भी बोलते हैं, what actually it is, it's a practical contact with an observation of facts or events, or an event or occurrence which leaves an impression on someone. As said by Albert Einstein, the only source of knowledge is experience, because we learn from our experience. So before moving on, I would like to have just a question to everyone. that can you please write in the chat box that how much time is required to make tea? Just for 30 seconds exercise it is. So please reply how much time is required to make tea. Please write in the chat box, because otherwise I'll have to go back and I'll have to add my presentation, then only I'll be able to see. So okay. 15 minutes, 5 minutes, 15 minutes, 3 to 5 minutes. So I think what all responses we have got, that is as per our experiences only. Either we have seen somebody making or we ourselves have made it. So experiences just like that only. We learn from what we do and what we see. Role of experience in memory creation. As we all know, we have a long-term memory, and that is of two types. One is explicit, that is declarative memory. Another one is implicit or non-declarative memory. What actually declarative memory is? Declarative memory is our recollection of the events or thoughts which we have gone through. And that is further of two types, that is episodic. Our experienced events come in the episodic memory. That is semantic. That is I think some problem with my laptop. I'm not able to see what is written.
You're not able to read?
Yes, ma'am. Actually, जो सबसे नीचे का लिखा हुआ होता है, because of that box which is coming over there, I'm not able to see what is written. Now, please guide me how.
So you want to read what your notes? You want to read simultaneously your notes? That is presenter view.
I'll continue, ma'am. No problem. So another one is our semantic and explicit. Among the explicit memory, we have two types. One is episodic, another one is semantic. In implicit or non-declarative memory, we have two things, that is procedural, which comes from the skills and actions. There is no role of recollection as such in this memory, and there is an emotional conditioning. So role of experience in healthcare communication. First is the importance of experience in life, that is personal and professional. Most of the time it happens when we sit with our elder persons, they guide us. कि लाइफ में कोई भी इशू हो जाता है या घर में कोई भी प्रॉब्लम हो जाती है, we sit our elders and they guide us, ऐसा नहीं ऐसा कर लो, you do this, you don't do that. So that is our personal thing that we learn from the personal experiences. And whenever we go for some job and we have to give our resume, then in resume, the most important thing which is considered is the experience, and that is our professional experience. On that basis only a job is given and the role which we are going to have is assigned to us. Second one is regarding the patient counseling. Experience sharing has a very important role in patient counseling, because being a medical officer and a obstetrician, what I have felt is most of the time it happens that patients are really so scared with their complicated pregnancy and high risk pregnancies. And sometimes we have to share our experiences with them, that we have gone through the same situation. There was a patient and the same situation was there, and that pregnancy landed up like this, and this is all happened. So I think role of experience is also there regarding the patient counseling. Third thing is in teaching medical students and staff, especially in medical colleges, and when we are working as a administrative in some hospital and we have to teach and we are a trainer, and then also role of experience is there, just like Indu ma'am teaches. In every session, we learn from ma'am's experiences. Then advantages of experience sharing. Experience sharing, it increases the emotional intelligence that can lead to better performance. It gives feeling of motivation by positive experiences, and it prepares us not to repeat the other's mistake. But all we are learning from the patient's perspective, how this, just like in the today's session, we learned that how we have to resolve the patient complaints, what all experiences ma'am shared with us, and that also prepared us not to repeat the same mistake. And if anything happens in future and a staff also does the same mistake, then we can guide our staff on the experience. Disadvantages of experience sharing, I think the case study is far better than experience sharing in professional institutes, as ma'am also told us in the last session. That case study is a very important thing. Ma'am also gave the example, just like a gynecologist and her resident made the mistake. And just instead of directly telling them that you have done this mistake, case study is far better there than experience sharing in professional institutes. Then we learn more by doing rather than only listening. So we learn more. So just we do and we learn a lot as compared to what we just listen and then we tell to others. So what all do's and don'ts we have to do while doing our experience sharing. Do's is it should be interesting. What all experiences we are sharing, it should be interesting. I think that that should be more related to the topic and should include the motivational aspects more and should contain the positive aspects more. And the response of audience is equally important. Don'ts is it should not be too long, it should not be too narrative because we have limits of time, and it should not have more emotional contents because then our purpose of experience sharing will not get fulfilled. The audience or the our listeners will drain away with that. So I think it should not be so more emotional. Where we can use it as a pedagogy in training program. Just we are doing that, and in counseling of the patients to reduce their worries and doubts. In capacity building of the staff or team, experience sharing has a very important role, and to guide others. Thank you. We cannot create experience, we must undergo it, I'd say.
Thank you. Thank you. Thank you, Amreen, for the presentation. So experience sharing is, I think, one of the very useful ways to engage people because immediately you are able to transpose people in that situation. Mentally, you are able to align them with you. You are able to create required hormones in their body by experience sharing. So when somebody is sharing an experience, and if I'm aligned with that person, experiencing goosebumps or crying, these are all an indication that how you have been able to align your audience with you. So experience sharing can be used by you as a trainer to initiate a discussion, to introduce a topic, to validate your point of view, and can also be used to invite people to start discussing. A lot of time you will have silent audience. A lot of learned people will be there in the group, but unless you ask them to talk, they will not talk. So you have to really invite them to share their experience, depending upon what is their area of expertise or what they are doing or their role in the system. And if you ask them to share their experience, you come up with wonderful, anecdotes and case studies which can be used for various purposes, for discussion, brainstorming, or validating your point of view or their point of view. And also sometimes the experience could be something very controversial or not in line with what is being taught. So you have to be really good at being able to explain and debrief that experience. So maybe you are talking something and you are validating a point. Somebody might come up with the experience sharing which is absolutely not in line with what you are talking. So there you have to be really experienced enough, intelligent enough to not get into the controversy of argument or proving the other person wrong. Handle it amicably. I really feel bad for what you experience. But I think, let me ask others, what do others say? And if everybody say, no, I don't think that's true. Maybe you had that experience, that's one odd experience. So then you end the argument there by saying, I know I'm not doubting your experience. What you're saying is absolutely right. But I think that's not a regular thing. Maybe in your case that happened and I feel bad for that. And we end it. But experience sharing is an excellent way to engage your audience and resource pooling, knowledge pooling. Because people will share their experience and it will be very rich learning for the group. Any thoughts, any questions about experience sharing as a pedagogy?
Thank you, Dr. Amreen, for the very nice, short and rich presentation, and it was very nice. One thing I wanted to share was that when we are sharing experiences in a with the audience which is known, or a closed audience, or someone within the organization. It sometimes gets tricky where we need to ensure that we don't reveal a lot of things which are not required to be shared. Maybe some names or some organizations' names or something like that. Otherwise, the focus goes on that particular person or an organization or the event rather than the actual message that we are trying to share. Because I have seen a few sessions where things go haywire just because someone mentioned someone's name.
Name and the organization's name.
Yes.
So it can misfire. I agree. And there can be an argument on it.
Yes.
There can be an argument, and there's a breach of confidentiality that also has to be. Thank you. I think that's a very valid point. In the don'ts, I think we have to be talking about it. And also, if I may share my experience, you have to be really very careful in picking the experience that you want to share. I have had an occasion where it misfired in my case. I was doing a program for a group of school children, and I narrated a case which was a real life case with the audience. But later on, when I reflected on it, I said that was not the case that I should have shared with them, because rather than enlightening and empowering them, it probably scared them and left them in disgust. So I mean, we all can make mistakes. Like I made mistake, and I'm admitting it to you. So we have to be really very careful to choose the experiences that you want to share, which are neutral and not like too sensitive or any religion or any political on political issues, because that can trigger controversy and confusion in the. So just yesterday, when I was taking that session for the Delhi Judicial Academy, one of the judicial officers started talking about the Kashmir files. And I knew I don't have to get into that. I said, I completely understand the sensitivity of the topic, but I think we'll be digressing from the issue. And if we start talking about it, I think we will not talk about it. We just have 1 hour and let's talk about stress management, and then we move. So you have to be really good at navigating your group. Thank you so much. I think it was a very good point, Dr. Kunal, that you mentioned. I mean, you made a wonderful presentation. I think we are learning the nitty-gritties of these things. So I think that's the idea, that now you will know experience sharing is also a pedagogy, an important pedagogy.
Yes.
And you will use it more often. I really want to do a program on storytelling, learn it. I'm really looking for a good, trainer who can train me how to go about storytelling, because people use storytelling as an excellent way to, narrate or make their point. So that's another art we must learn. Chandana, do let me know if you get in touch with anybody who is good at storytelling.
Yes, I was about to suggest. I will message you individually about that.
Sure, that will be a wonderful learning for me. Thank you. Thank you. So before we end, any comment, anything that you want to say? Just verbally, I want to ask, are you finding this session useful? These sessions useful? Are they making sense? Because that's very important. That's very important.
Yes, of course, ma'am. It is definitely making sense, and role play is really helpful because going theory by theory or more than the theory part, it makes. I mean, we can connect more with the situation if we do the role play. So that's really helpful. And just mere going by the slides, I think I'm that kind of a learner who loves to learn by interacting. So this is more helpful for me. I mean, that's helpful for me. Yeah.
So good, Chandana. So if I may understand what you're trying to say, even I have made it a point that in every session we should have small role play, because we learn by observing and we are immediately able to connect with the person who are playing. And there's a lot of scope to reflect also. When you role play, you're able to see the challenges of people who actually do this role every day. That's one idea. And then at the same time, I keep a short presentation always as a supplement, because a lot of time my participants have given this feedback, ma'am, agar PPT hota na maza aa jata. Because some people still require some content when they want to go and do it. So I feel it's okay. Let me make a small presentation.
Everybody has their own individual learning style.
Exactly.
So,
so as a facilitator,
I think this is your learning style is a quite wholesome kind, because you use PPTs, you use experiential learning as well. So all contents are in appropriate proportion. So I really like it. I'm enjoying it. Yeah.
And that's what I want you to go back with clarity, that a program should never be one kind. It should always have a mix of things, because you have varied audience. Somebody will be a visual learner, somebody will be an audio, fond of audio, somebody would like to do it. So if you have a mix of everything, then everybody is happy with your this thing and they learn. They get to learn. So I think we are dot on time, or maybe 5 minutes before time, if I'm not wrong, because one presentation we haven't done. We have done, instead of two, we have done only one presentation.
Ma'am, but I have a very kind request that at the end of all the sessions, we would like to see one of your presentation which you have presented somewhere, so that we come to know that how we have to make our own presentation, because we are very new in this. So I think it would be much better.
Amreen, if you will go to YouTube, a lot of my programs I have uploaded on my this thing. I've done for US, certain US organizations, for Indian organization. I think 2020 onwards, prior to that, I was not open to the idea of YouTube recording at all. It would be only, some interview, some interaction, that's all. But after that, since the time this COVID thing happened, I've done, I think, 40, 50 webinars. And most of the webinars I have posted on the thing. But let me tell you, the way I'm doing with you, that's the way I do with everybody. It is not different. But you can see. I did a program for SCCOM, that is Association of Surgeons of India. So they got the trainings done for their residents from me. It was almost like, again, 6-8 hours program, 2 hours program I did for 1 week. I think they are on the YouTube, if I'm not.
Okay, ma'am. I love
they are there. Yeah. You can have a look. Yeah.
Maybe, ma'am, once you are back to India, we can have one in-person session.
Oh, yes.
At any point of time when you arrange any workshop or something, we would surely, on behalf of the batch, I can say that we all would like to meet and experience the kind of training in person.
Same here. So December, when I started the program, that was the first batch. In those days, I was doing training at Maulana Azhar Medical College for the medical students. That is very different from what I'm doing with all of you. That should actually, if I do that, it will be altogether a different program for the faculty who will be teaching medical students. So that's a different thing. But then I invited my participants that if you want to come and see my training in Maulana Azhar. So a couple of the participants did come and spend the whole day with me. It was from 9 to 4. So they were there with me and they observed the training program. But incidentally, now I'm here and I'm not doing any, on-site training. But once I come back to India, then definitely we'll see how we can connect well. Anuradha, of course, has seen me a number of times in the.
Yes, I have been fortunate, ma'am. Yes.
Anuradha has seen me. We have been in touch for good 4-5 years, and I've done a lot of programs for PHFI, Public Health Foundation of India. So, and she has invited me all across the country. Yeah. So if there are no more questions, we'll close the session here and meet next Tuesday. I can see Dr. Tanu is very tired. Very sorry to keep you up till this. Extremely sorry, but ma'am, you're on mute mode. Tanu ma'am, you're on mute mode. Unmute kariye.
I'm traveling to US tomorrow night, so I'm in the midst of packing and everything.
That's up to you. That's up to you. That's up to you. Kahan aa rahe ho US mein?
West Coast, San Diego. I think you are on the East Coast. From your timings, I think you're on the East Coast.
Yeah, so, Florida. I'm in Florida.
You're in Florida. Oh.
Yeah. So how long are you going to be here?
About 5 weeks. I haven't booked the return ticket, but probably 5 weeks.
Wonderful. Welcome. Let's see how we can come. So thank you one and all. Thank you for being there. It's very late for you. And good night to all of you.
Good night. Thank you.
Thank you.
Thank you.
Good night.
Bye.
Thank you, everyone.